there and welcome again. My name is Dr. Lopez. Let's discuss carbamazepine. Carbamazepine is a very important mood stabilizer, especially for the board. It has a high drug-to-drug interaction. Has a warning for the Asian population because of agranulocytosis, and there are many aspects of carbamazepine that you need to know for your PMHNP board certification. So let's dive right into it. This is our roadmap. We are about the middle of our module 1 series. Now we will discuss carbamazepine. Okay? So carbamazepine, just like valproic acid, had a black box warning of liver and hepatitis, right? Liver toxicity and hepatitis. So carbamazepine has a black box warning, and that is for agranulocytosis and aplastic anemia. So any drugs that has a black box warning, it's important information. So when we say agranulocytosis, we are talking about the decrease in white blood cells. Okay, aplastic anemia patients would present with pallor, fatigue, headaches, fever, bleeding, nose bleeding. Okay, bleeding of the gums, skin rash, and shortness of breath. So Steve Johnson syndrome, particularly in Asian individual, you have to screen for the HLA-B 1502 allele before initiating this drug. This is super high yield, super important that you understand. Steve Johnson syndrome, you have to screen the patients before you prescribe carbamazepine if they are of Asian population. Okay, so it's highly associated with carbamazepine-induced Stevie Johnson syndrome. Always check for pregnancy status by getting your HCG. And in terms of the board, that's anyone of any woman of age 12 to 50. You must add, or you should add to your practice, adding a folic acid because it supports neurotube development during the first months of pregnancy. Okay, and that's the quantity there, 0.4 to 0.8. It's an important consideration. Now, when you hear carbamazepine, think of the three A's. You see carbamazepine, the first A, second A, and third A, right? So the first A is for aplastic anemia. The second A is for agranulocytosis, and the third A is for Asian population. So when you see carbamazepine, you will remember the three A's: aplastic anemia, agranulocytosis, and the Asian population. Now, how to remember all this? Carbamazepine, you can memorize by carbon, Z for the fatigue, and pain. So that's color pale, agranulocytosis, rash, bleeding of the gum, aplastic anemia. Stop the med, right? If you see any of those symptoms. A for the Asian, vulnerability to Steven Johnson syndrome, disease for the fatigue, pregnancy, neurotube defect. It can cause neurotube defect. I for increasing SOBs, shortness of breath, nosebleed, and elevated temperature. But mostly know that these facts here are very, very important, and you should really memorize all this here about carbamazepine. Black box warning, right? For agranulocytosis, aplastic anemia. For the Asian population, it's associated with Stevens-Johnson syndrome. Know which lab to get screened for before you give this medication. Always check for pregnancy status and the 3A rules: aplastic anemia, Asian population, and agranulocytosis, which is decrease of the white blood cell count. Questions could be something along the lines of, you notice a patient had a fever, had bleeding of the gums, or had perhaps bleeding of the nose. What would be your next action? So the next action should be to stop the medication, collect labs. That's just an example, okay? So the therapeutic level is between 4 to 12 for seizure control. Liver enzymes is an inducer, so carbamazepine may decrease the efficacy of other drugs. Remember the inducers and the inhibitor concept covered earlier today. So think about the CNS side effects, which is dizziness, drowsiness, and ataxia are common. Monitor and adjust the doses needed. And hyponatremia. What other medication cause hyponatremia? Remember we talked about hyponatremia and lithium? Well, it also can cause hyponatremia. Carbamazepine can cause a decrease in serum sodium levels, monitor electrolytes level, particularly during the treatment. So let's do a check on learning. In the Asian population, which medication among these options would raise the most concern? Depakote, carbamazepine, lithium, or Lamictal? And why? Well, carbamazepine is an anticonvulsant associated commonly used to treat epilepsy and bipolar disorder. In the Asian population, there is an increased risk of developing Stevens-Johnson syndrome or toxic epidermal necrosis, severe skin reactions that can be life-threatening. Due to this risk, it would be likely be the medication that raises the most concern in the Asian population. So let me clear something up here. So Stevens-Johnson syndrome can also be caused by Lamictal. However, if the question asks you, in the Asian population, which of the following medications would you be most concerned with Stevens-Johnson syndrome? Then would be carbamazepine because it's lithium. If carbamazepine wasn't here, and the question would be a 65 years old, blah, 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 taking a medication and it's causing Stevens-Johnson syndrome, which one would you likely to be the cause of the Stevens-Johnson syndrome? You pick Lamictal. If it has Asian in the question, pick carbamazepine. If it doesn't, pick Lamictal. Okay? Because both of them can cause Stevens-Johnson syndrome. All right, another interesting fact for your own knowledge and pearl during your clinicals: when starting Lamictal, start in a very low dose. So the Lamictal dose for bipolar would be anywhere between 150 to 200 milligrams. That now you start at 25, and then you wait 2 weeks, and then you increase to 50. Why? Because Stevens-Johnson syndrome. So you have to start Lamictal very slow. Wait 2 weeks, double the dose. Wait 2 weeks, double the dose. Wait 2 weeks, double the dose until you get to the level of 200 just about, and continually to reassess your patient. Okay? Just mention this because I've seen a lot of people starting Lamictal at 150, 160, and that's very dangerous. Okay? Don't be the one. I'll see you on the next module.